Greetings, everyone. I am Kale Pantoniel.
And I am Francis Paulin.
Together, we'll be talking about dental infection control.
That's right, Kale. Stay tuned for a surprise right at the end of this video.
Dental Infection Control P2 Informative Video Requirement from the workbook by Dr. Junhel Dalanon PhD. Welcome to the forefront of healthcare innovation. In today's informative video, we'll talk about the emerging trends in infection control and explore Section 12.1, 12.2, and 12.3. First up, Section 12.1 New Technologies and Advancements in Infection Control. First, we introduce UVC disinfection systems. These systems utilize ultraviolet light to effectively eliminate harmful pathogens from surfaces and the air, ensuring a sterile environment for patients and healthcare workers alike. Next up, automated hand hygiene systems. These revolutionary devices streamline hand hygiene practices, ensuring optimal cleanliness with minimal effort, reducing the risk of cross-contamination. Antimicrobial surface coatings take center stage, transforming ordinary surfaces into active defenders against microbial invasion. These coatings provide continuous protection, bolstering infection control efforts throughout the facility. Single-use disposable devices offer unparalleled convenience without sacrificing safety. By eliminating the need for sterilization and reuse, these devices minimize the risk of infection transmission, safeguarding patient well-being. Sterilization monitoring technologies provide real-time feedback on sterilization processes, ensuring equipment and instruments meet the highest standards of cleanliness and safety. Digital documentation and record-keeping streamline infection control protocols, allowing for efficient tracking and management of patient data, treatment plans, and sanitation procedures. Air filtration and purification systems purify the air, removing harmful particles and pathogens, creating a healthier environment for all within the facility. Teledentistry and virtual consultations revolutionize dental care delivery, offering patients access to remote consultations and treatment options, reducing the need for in-person visits and minimizing the risk of exposure to infectious agents. Lastly, 3D printing for customized devices enables the creation of personalized medical tools and devices, optimizing patient care and treatment outcomes.
Moving on to Section 12.2, we delve into antimicrobial stewardship in dentistry, highlighting specific subtopics including 1. Appropriate prescribing practices, ensuring antibiotics are prescribed judiciously and only when necessary to prevent antimicrobial resistance and minimize adverse effects. 2. Culture and sensitivity testing, testing methods to identify specific pathogens and determine their susceptibility to antibiotics, guiding treatment decisions for optimal patient outcomes. 3. Prevention and infection control strategies, implementing measures such as hand hygiene, sterilization protocols, and environmental controls to prevent the spread of infections within dental settings. 4. Patient education, educating patients about the importance of oral hygiene, infection prevention measures, and the appropriate use of antibiotics to promote oral health and reduce the risk of antibiotic resistance. 5. Collaboration and communication among healthcare providers, fostering collaboration between dentists, physicians, and other healthcare professionals to coordinate patient care, share information, and optimize treatment outcomes. 6. Ongoing monitoring and evaluation of antimicrobial usage, continuously monitoring antimicrobial prescribing practices, antimicrobial resistance patterns, and treatment outcomes to identify areas for improvement and guide future interventions.
Finally, in Section 12.3, we explore current research and future directions in infection control, addressing specific subtopics such as 1. Antimicrobial resistance, the ability of microbes to resist the effects of antimicrobial drugs, leading to difficulties in treating infections and posing a global public health threat. 2. Biofilm control, strategies to prevent and disrupt biofilm formation, a complex microbial community that adheres to surfaces and is highly resistant to conventional disinfection methods. 3. Surface disinfection techniques, innovative methods for effectively disinfecting environmental surfaces to reduce the transmission of pathogens and prevent healthcare-associated infections. 4. Aerosol management, measures to control and minimize the generation and spread of aerosolized particles during medical procedures, reducing the risk of airborne transmission of infectious agents. 5. Personal protective equipment innovations. Advancements in the design and use of personal protective equipment to ensure the safety of healthcare workers and prevent the spread of infections in healthcare settings. 6. Water line management. Strategies to maintain the quality and safety of water used in healthcare facilities, minimizing the risk of waterborne infections and ensuring patient safety. 7. Point-of-care testing advancements. Innovations in rapid diagnostic tests that provide timely and accurate results at the point of care, facilitating early detection and treatment of infections. 8. Integration of artificial intelligence and data analytics. Utilizing artificial intelligence and data analytics to analyze large datasets, identify trends, and predict outbreaks, enhancing infection control strategies and public health interventions. 9. Importance of education and training in combating infectious diseases. The critical role of education and training in equipping healthcare professionals with the knowledge and skills to effectively prevent, identify, and manage infectious diseases, ensuring the delivery of high-quality patient care. Together, through the implementation of these cutting-edge technologies and the commitment to best practices, we stand united in our mission to safeguard public health and ensure the well-being of all those we serve. Remember, the key takeaway from all these efforts is simple. A safer, healthier future starts with each one of us.
You have come this far, and we assume you were waiting for the surprise. But before that, we would like to thank you for listening. Don't forget to hit that like button and subscribe for more videos like this.
Here is the surprise.